My name is Donna Roberts, and my presentation is The Addictive Personality, Myth or Cornerstone of Prevention and Treatment. The concept of an addictive personality offers an attractive and intuitive construct for defining the parameters of prevention, diagnosis, and treatment of substance abuse and addictive disorders. However, despite the intellectual and practical appeal, it remains controversial, with researchers and practitioners heavily debating its fundamental validity. Psychologists have defined personality as the set of psychological traits and mechanisms within the individual that are organized and relatively enduring, and that influence his or her interactions with and adaptations to the intrapsychic, physical, and social environments. As such, it represents a comprehensive and stable characterization of an individual. According to the American Society of Addiction Medicine, addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. Dysfunction in these circuits leads to characteristic biological, psychological, social, and spiritual manifestations. This is reflected in an individual pathologically pursuing reward and/or relief by substance use and other behaviors. Addiction is characterized by inability to consistently abstain, impairment in behavioral control, craving, diminished recognition of significant problems with one's behaviors and interpersonal relationships, and a dysfunctional emotional response. Thus, consideration of an addictive personality assumes that the tendency to adopt and maintain these addictive behaviors is woven into the very fabric of the individual's overarching patterns of thought, emotion, and manner of behaving. The perspective posits that certain personality types are more predisposed, some even assert destined, to develop and maintain psychological and/or physical addiction. The designation of addictive personality does not appear among the 10 personality disorders of the current Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Furthermore, the DSM-5 lists 9 specific types of substance addictions, with substance abuse and substance dependence measured on a continuum from mild to severe. These types are further described by 11 distinct criteria, none of which refer to personality characteristics. While the terms addictive personality and addictive personality disorder are largely not officially recognized in academic and professional research and practice, they abound in the general dialogue, having their roots in the fundamental stereotype of addiction as a character disorder, and the underlying desire to be able to cleanly and clearly identify a targeted cause in order to modify its effects. These designations appear in venues as diverse as healthguidance.org, High Beam Research, Psychology Today, The New York Times, addiction.com, medic8.com, recovery.org, webmd.com. While these sources are not generally considered scholarly research, they no doubt have influence upon the social consciousness as well as aspects of the recovery movement. Researchers have long been interested in identifying individuals at risk for developing substance abuse disorders. With respect to distinguishing individual differences, the trait of extroversion was frequently targeted for examination. Specifically, early on, various researchers hypothesized that individuals respond differently to alcohol consumption based on their level of extroversion. While some correlations have been noted, the research findings have proven inconsistent and have not supported a general association between specific temperaments and addictive tendencies. More recently, the concept became popularized in the social consciousness in the 1980s when Alan R. Lang conducted seminal research as a meta-analysis in an attempt to determine the nature of an addictive personality if in fact one existed. His intention therein was stated as a practical and applied purpose. If we can better identify the personality factors, they can help us devise better treatment and can open up new strategies to intervene and break the pattern of addiction. Lang's research conducted for the United States National Academy of Sciences concluded that, while there is no single set of traits that is definitive of an addictive personality, several significant personality factors exist, including impulsivity, sensation seeking, nonconformity combined with weak commitment to socially valued goals for achievement, social alienation and tolerance for deviance, and heightened stress coupled with the lack of coping skills. While not representative of a personality type per se, these conclusions did highlight aspects of trait and temperament as they play a significant role in the development of sustainment of addictive behaviors. Proponents of the view that personality plays an influential role in addiction argue there is little question of whether personality is associated with problematic alcohol involvement, such as alcohol use disorders. It clearly is. However, the question remains, how or why is personality related to risky drinking and AUDs? Although the identification of an addictive personality, that is, a specific configuration of personality characteristics linked to addictive behaviors, has largely been abandoned, numerous studies demonstrate links between specific personality traits and problematic alcohol involvement. More specifically, although traits related to impulsivity and disinhibition appear to demonstrate the most robust and consistent relation with alcohol involvement, all 5 factor traits, that is, openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism, have been shown to correspond with varying degrees of consistency to alcohol use and outcomes. Despite the equivocal results, research continues to examine potential correlations between personality-like influences and the development of addiction. Building on the previous research, Whiteside and Lyman employed factor analysis to identify 4 distinct personality facets related with impulse-like behavior: sensation seeking, lack of planning, lack of persistence, and urgency, or acting rashly when distressed. Other researchers have explored associations between specific traits and their related behaviors. This figure represents the psychobiological model of temperament and character, which depicts the relationship between personality and habit systems, an integral aspect of addictive tendencies. Still, other researchers have examined the relationship between motives related to addictive behavior and personality traits. Despite these efforts, however, clear and consistent connections to broad personality traits and types remains elusive. The fact that empirical research does not conclusively support a clear and defined picture of an addictive personality is not surprising, but nor does it negate the potential insights to be gained by considering personality as an important factor in both the development and recovery of substance abuse disorders. Empirical research that attempts to yield consistent predictive results from personality research often yields equivocal results, in part due to the difficulty in determining a comprehensive yet specific framework for defining personality. There is significant debate about whether personality, as we currently define and measure it, even provides a valid and reliable explanation and/or predictor of behavior. Beyond that, there is significant disagreement about how to define personality in a measurable, specific, yet comprehensive way. Among themselves, personality psychologists do not agree on various fundamental aspects of the construct, such as trait versus type, and thus do not embrace a single set of stable personality measures that consistently yield valid and reliable predictive results. Furthermore, there is sufficient evidence that factors other than personality profiles, such as situational aspects, abilities, and motivation, also influence performance. Equivocal results have indeed been the status quo for decades of research linking personality to specific behaviors. Personality and addiction both represent complex constructs with numerous interacting variables. Despite efforts of researchers to refine and fine-tune measurements, methodologies, and procedures, results have provided few direct links between the variables that comprise these complex constructs. Human behavior in any context is always a complex and multifaceted combination of various internal and external variables working in concert to produce what might appear as a singular aspect of behavior. It is, as the Gestaltists argue, more than the sum of its parts. That says, because a concept, particularly a concept as intuitive and fundamental as personality, has not been perfectly honed in an empirical sense, it does not mean that it has no clinical value. When we focus our microscope down to a more micro level, we see that addiction and attempts at recovery represent individual stories of pain and healing, strength and weakness, failure and success. It is, after all, at this level where true change is made and at which the real purpose of psychology, understanding the human condition in order to make it better, exists. Therefore, any tool, any construct, any conceptualization that leads to growth and recovery of the human spirit is valid beyond its psychometric properties. As we now face a global epidemic of opioid abuse that surpasses previous waves of drug use in both magnitude and severity, perhaps it is time to reevaluate the role of personality as a contributor in both the development and rehabilitation of addiction, and how such information, taken in context with other relevant factors, can best serve to combat the widespread epidemic. Thank you.